Welcome to this deep dive. You've sent us a really fascinating collection of materials, all focusing on understanding mental health.
Yeah, lots to unpack here.
Definitely. Our goal today is really to get to the heart of this complex topic.
Yeah.
Pull out the crucial insights, connect the dots, without making you feel like you're, well, drowning in information.
Exactly. We're going to explore what it really means to be mentally healthy and how that's different from mental illness.
Okay.
And look at what makes us vulnerable, maybe some early signals to watch for, and also the encouraging reality of recovery.
And we'll touch on everyday stress too, right? And how big events like the pandemic impact our well-being.
Absolutely. Think of this as your sort of shortcut to getting a deeper understanding. There are some surprising stats in here, too.
Okay, let's start at the foundation then.
hmm
The sources we looked at really emphasize that mental health isn't just, not being ill. It's much broader.
Right. It's about our emotional, psychological, and social well-being, how we handle our thoughts, feelings, actions.
How we manage stress, make healthy choices, all of that.
Exactly. And what struck me is how dynamic it is. It's not static.
Yeah, it ebbs and flows, doesn't it?
Sure.
Depending on what life throws at you, like a tough job or family issues.
And this ties directly into our ability to live a full life, doesn't it?
How so?
Well, good mental well-being equips us to cope with stress, which is inevitable,
Okay.
to be productive, to tap into our potential, and, contribute to our communities. It's kind of the engine for a satisfying life.
Right. And then on the other side of that coin, you have mental illness, sometimes called behavioral health issues.
Yeah, these are actual conditions affecting thinking, feeling, behavior, mood.
Things like depression, anxiety, bipolar disorder.
Yeah.
And the sources say there are, over 200 types?
It's a huge range. And it's important to remember people can experience more than one condition at the same time.
That brings up a really critical distinction the sources make, doesn't it? Poor mental health isn't necessarily the same as a diagnosed mental illness.
Exactly. You might feel stressed or down for a bit, have a period of poor mental health, but not meet the criteria for an illness.
And conversely, someone with a diagnosis can still have periods where they feel well.
Right. But the sources do highlight the impact of serious mental illness. That's where it really interferes with major life activities.
And there are physical health implications too.
Yeah, that's quite concerning. People with serious mental illness have a higher risk of things like heart disease, diabetes, and often a shorter lifespan, sometimes because physical issues get overlooked.
Okay, so given all that, what can we actually do to boost our mental well-being? The sources offer quite a few self-help strategies.
It's like a toolkit, really. Things like prioritizing quality sleep, which is huge.
So many of us don't get enough.
True. And a healthy diet, fruits, vegetables. Social connection is another big one.
Staying connected with friends, family.
Yes, and regular physical activity. Even simple things like journaling, regular medical checkups, relaxation techniques.
Like mindfulness or deep breathing.
Exactly, those are all mentioned. And framing things positively, helping others, avoiding too much alcohol.
It sounds like it's about building resilience, fundamentally.
That's a great way to put it. Developing coping skills, knowing when to seek professional help, and educating yourself if you do get a diagnosis. These are all key.
Okay, so when might a rough patch signal something, more serious? What are the risk factors for developing a mental illness?
The sources point to a mix of things. Biology plays a part, genetics, brain chemistry, stuff we can't really control.
Right.
Then there are life experiences, trauma, abuse. Family history is often significant.
What about other health issues?
Chronic medical conditions, definitely. And substance use. Even loneliness or isolation can increase the risk.
And alongside those risks, there are often early warning signs, right? Things to look out for.
Yeah, subtle shifts sometimes, like big mood changes, more irritability, anxiety, or severe swings.
What else?
Persistent intrusive thoughts, changes in eating or sleeping habits, way more or way less. Pulling back from social life.
Low energy, feeling numb.
Exactly. Difficulty with everyday tasks, unexplained aches and pains sometimes, feelings of hopelessness.
Increased substance use, maybe. Confusion, forgetfulness.
All potential signs. And obviously, any thoughts of harming oneself or others need to be taken extremely seriously, immediately.
But, and this is crucial, the sources are really clear that recovery is possible, right?
Absolutely. Many people recover completely. There's even data showing benefits for employers when staff get treatment, lower costs, higher productivity.
I liked how they framed recovery around those 4 dimensions. What were they again?
Health, home, purpose, and community.
Health, home, purpose, community.
Yeah, health is about managing both mental and physical well-being. Home is having a stable, safe place.
Purpose, like work, volunteering.
Right, finding meaning in activities. And community is about connections, support networks. It's a holistic view.
It's not just about symptoms disappearing, it's about building a meaningful life.
Precisely. And for friends and family wanting to help, the advice is quite practical.
Like what?
Just being available, helping them find services if needed, staying optimistic, recognizing their strengths.
Treating them with respect, not defining them by their diagnosis.
Exactly. Basic human connection and support go a long way.
To really grasp the scale of this, the sources had some, frankly, startling statistics for the U.S.
It really did. Like, 1 in 5 adults experiencing mental illness each year.
1 in 5. Wow. And over half of all people diagnosed at some point in their lifetime.
Yeah. And the treatment gap is concerning too. Only about 44% of adults who need treatment actually get it.
And the suicide statistic, every 11 minutes in the U.S., that's just devastating.
It really highlights the urgency, and it connects to the need to bust some common myths.
Ah, yes, the stigma, like the idea that mental illness is a weakness.
Right, or a character flaw. That people should just snap out of it. It's completely false. These are real health conditions needing support, like any physical illness.
And the myth about violence.
Also debunked. The vast majority are not violent. They're actually more likely to be victims of crime. And people with mental health conditions can absolutely work and lead productive lives.
Okay, let's shift focus a bit to kids and teens. The sources highlighted this as a critical area too.
Very much so. Around 1 in 5 children or teens will have seriously debilitating mental illness.
1 in 5. And 1 in 10 adolescents experiencing major depression.
Yes. Young people deal with significant stress and anxiety too, specific fears like separation anxiety or just general worry.
And depression in teens can look like persistent sadness, hopelessness, changes in habits, even self-harm.
Correct. Plus, ADHD, disruptive behavioral disorders, and substance use is a concern among teens as well. Treatment rates are often low in this group too.
So how can parents or caregivers support kids and teens?
Stability is key. Open communication, helping them get professional help if needed. Consistent routines, healthy habits.
Encouraging social connections, letting them express feelings safely.
Yes, and being alert to behavior changes. Offering reassurance. It's about creating that supportive environment.
Let's dig a bit deeper into depression. The sources spend quite a bit of time on this, calling it common but serious and treatable.
Right, it's a mood disorder affecting feelings, thoughts, actions, more common than bipolar disorder, apparently.
It's more than just sadness or grief, right?
Definitely. It's persistent, debilitating. Women are more likely to experience it statistically. And there can be links to physical health problems.
What about risk factors for depression?
Again, a mix. Stressful events, isolation, family history, brain chemistry differences.
Low self-esteem, feeling overwhelmed, pessimism.
Those can contribute too. And the sources break down different types. Clinical depression or major depressive disorder is the main one.
With severe symptoms affecting daily life. Irritability, fatigue, concentration problems, loss of interest.
Yes, changes in appetite or sleep, suicidal thoughts, even unexplained physical issues. Ruling out other medical conditions first is key.
And postpartum depression. That's distinct.
Yes, occurs after childbirth. More intense and longer lasting than the baby blues.
Similar symptoms to general depression, but maybe also guilt about parenting, doubting their ability, withdrawing.
Exactly. And specific risk factors too, like a prior history of depression or pregnancy complications.
How is depression actually diagnosed?
It involves a thorough evaluation by a professional, looking at symptoms, history, other factors. Symptoms need to last at least 2 weeks and affect functioning.
But the good news is it's highly treatable, like
Wow.
80–90% success rate.
That's what the sources indicate, which is very hopeful. Treatment usually involves a few approaches.
Medication, like antidepressants.
Yes, they can help regulate brain chemistry. Not usually habit-forming, but they take time to work. Adjustments might be needed.
And psychotherapy or talk therapy.
A cornerstone. Alone or with meds. Different kinds, like CBT, cognitive behavioral therapy, focusing on changing negative thoughts and behaviors.
What about for very severe cases?
ECT, electroconvulsive therapy, might be considered if other treatments haven't worked. There are also therapies like cognitive processing therapy or prolonged exposure for trauma-related depression.
Stress inoculation therapy. Complementary things like art or pet therapy.
Those are mentioned too, often as supportive measures.
And depression in older adults, that's often missed.
Yes, sometimes mistaken for aging or other health issues, social support programs can be really helpful there.
The sources included a sample depression questionnaire too, didn't they?
Yeah, as a tool for self-reflection to discuss with the doctor. They also briefly mention bipolar disorder, those shifts in mood and energy, and contrast grief with major depression.
Okay, let's turn to stress. We all experience it, but the sources define it as a reaction to feeling threatened or anxious.
Right. And apparently, stress levels reported in the US are higher than the global average. Some stress can be motivating, but often it's overwhelming.
And it shows up physically and emotionally. Irritability, focus issues, headaches, stomach problems.
Even using substances to cope. The sources list quite a few symptoms, and they detail specific stress disorders.
Like PTSD, post-traumatic stress disorder.
Yeah, triggered by experiencing or witnessing trauma. Symptoms include flashbacks, nightmares, hypervigilance, sleep problems, distress from reminders.
Then there's acute stress disorder.
Similar, but shorter duration right after the trauma. High risk of it becoming PTSD, though.
And adjustment disorder.
That's a response to a major life stressor, like a job loss or divorce. Symptoms are more intense than expected, but usually resolve within about 6 months.
So how do we cope with stress in healthy ways?
A lot of it echoes the self-care stuff. Good diet, exercise, sleep, taking breaks, talking to people, avoiding substances.
Limiting endless news scrolling.
Definitely advised. And the sources couldn't ignore the impact of the COVID-19 pandemic, obviously.
Huge impact. Statistics showed negative effects, more anxiety, depression, substance use.
Loneliness from isolation, money worries, burnout, low self-esteem, worsening of existing conditions, a whole range of challenges.
They even mentioned coronaphobia.
Yeah, specific anxiety about the virus itself, excessive worry, health anxiety. There was even a specific scale for it.
And tips for coping with that stress.
Maintaining treatment, knowing reliable sources of info, but taking breaks from the news, setting daily goals, healthy habits, relaxation, staying connected, leaning on beliefs, basically proactive coping.
Okay, moving on to anxiety. The sources say it's the most common type of mental disorder.
That's right. It involves excessive dread, fear, apprehension, often leading to avoidance that messes with daily life.
Risk factors include family history, psychological factors, stressful environments.
Yes. And there are many specific types detailed. Generalized anxiety disorder, or GA, that's chronic, excessive worry about lots of things.
Phobias, intense fear of specific things like heights or spiders.
Exactly. Agoraphobia, fear of situations where escape might be tough. OCD, obsessive-compulsive disorder, with unwanted thoughts and repetitive behaviors.
Panic disorder, those sudden attacks of intense fear.
Yes, with strong physical symptoms. Separation anxiety, common in kids but can affect adults. And social anxiety disorder, fear of social situations, judgment.
What are the general symptoms across these disorders?
Things like constant worry, trouble concentrating or sleeping, feeling restless or on edge, fatigue, muscle tension.
And diagnosis involves looking at whether the fear is disproportionate and if it's impacting function.
Right. And like depression, there are effective treatments. Starts with a medical checkup.
To rule out physical causes.
Exactly. Then psychotherapy, especially CBT, is often very helpful.
Medications too. Anti-anxiety drugs,
Yeah.
antidepressants, beta blockers.
Yes, different types can be used. For kids, SSRIs or SNRIs might be prescribed. Stress management techniques, support groups, educating loved ones.
Avoiding caffeine probably helps too.
Good point. Yes, avoiding stimulants is often recommended.
Yeah, okay, nearly there. The sources also covered substance use and addiction.
Defined as compulsive use despite harm involving changes in the brain's wiring. They list common addictive substances.
And the stats show high rates of binge drinking, illegal drug use, and substance use disorders generally.
Yes, and how often it co-occurs with other mental illnesses. Treatment rates are low here, too.
Symptoms fall into categories, right? Impaired control, social problems, risky use, tolerance, withdrawal.
Correct. Risk factors are discussed, things like genetics, environment, peer pressure, but also protective factors that reduce risk.
And treatment, what does that involve?
It starts with acknowledging the problem, maybe an intervention, then assessment, possibly medication for withdrawal or cravings.
Therapy is key. Individual, group.
Crucial. Different levels of care exist: hospitalization, residential programs, outpatient. And self-help groups like AA or NA provide peer support.
The sources briefly mentioned a few other things too, like personality disorders.
Yes, those inflexible traits causing problems. And the schizophrenia spectrum, psychotic disorders with hallucinations, delusions. Important to note, it's not split personality.
And finally, the really tough topic of suicide prevention.
Critical information. Statistics show it's a leading cause of death, especially for younger age groups.
Risk factors include past trauma, family history of suicide, lack of support, isolation, access issues.
Higher rates in some groups, too. And the warning signs are vital to know.
Expressing hopelessness, talking about death, making plans, feeling like a burden, withdrawing, mood swings, increased substance use.
Changes in habits, giving things away. If you see these signs, the advice is clear. Take action.
Call 911 if it's immediate danger.
Yes. Ask directly if they're thinking about suicide. Stay with them. Remove potential means. Listen without judgment. Show you care.
And connect them to help, like the 988 Suicide and Crisis Lifeline.
Absolutely vital. The sources also list different mental health professionals, psychiatrists who can prescribe meds, psychologists, social workers, counselors.
And a list of key resources like 988, the Disaster Distress Helpline, Domestic Violence Hotline, and others.
Yeah, really important contact information there.
So wrapping this up, the big takeaway seems to be that mental health is this huge spectrum, from everyday well-being right through to serious illness.
Exactly. And early awareness, understanding the risks and signs, and knowing that help and recovery are possible, that's all crucial.
The information from these sources really drives home how connected mental and physical health are and how much our environment and society matter.
It really reinforces the need for understanding, empathy, and being proactive, both in seeking help for ourselves and offering support to others.
So here's a final thought for you, listening. Based on all this, what's maybe one small, actionable step you could take today? For yourself or for someone you know?
Maybe it's just checking in with a friend, or looking up one of those resources, or committing to one self-care strategy we talked about.
Whatever it is, thank you for sharing your sources with us for this deep dive.